we want to start the show today with an exclusive story that we just dropped over on Patreon and Locals. The headline, Washington State Hospital quietly reforms gender clinic. The move comes after a former therapist blew the whistle in an article in the Free Press. So you will recall, if you're fans of the show, this story very well. We're talking about MultiCare's Mary Bridge Children's Hospital down in Tacoma, where they have a gender clinic. Back in February, a former therapist for MultiCare named Tamara Pietzke came out in a whistleblower report in the Free Press and shared her story about why she quit her job with MultiCare, saying she was told to approve all teen gender transitions, and she refused. And in there, she detailed essentially how she wasn't really given a choice. She was asked to sign a letter sending young patients to the hospital's gender clinic, even if they had other issues that she wanted to dive into as a therapist that might explain why these young people, 12, 13, 14 years old were or thought they were experiencing gender dysphoria. So Tamara Pietzke had published her initial article in the Free Press. At the time, she'd already quit her job with MultiCare. She'd been working as a therapist elsewhere, because of probably, they never admitted it, but likely because of her report in the Free Press. She was then fired immediately from the new job that she had. So she's been working in private practice ever since. But we had her on the show after her Free Press report was published, and she talked to us about some of these, what I would just call horror stories of what she saw in this hospital and in the gender clinic. So she would get referred patients, and she was a therapist for all kinds of different patients, adults and kids, some, yes, kids that came there hoping to get a referral for gender hormone therapy, etc. And there was in particular a 13-year-old girl who had been sent to her for therapy, who apparently wanted to, or her dad thought she wanted to transition to become a boy. And so what they were looking for was a signature from Tamara Pietzke to send this 13-year-old to the gender clinic. And as Tamara discussed on our show back in February, there were a whole host of issues that this young girl was dealing with that needed to be addressed before she underwent some sort of life-altering gender changes. Here's a clip.
Extensive trauma history, told me that there are times when she'll age regress. That's the phrase she used, where she'll sit and watch Teletubbies for hours and suck on a pacifier. And when I asked her about her upcoming gender clinic appointment, she didn't even know she had one. So here we are, trying to get a letter for this child to start testosterone, and there's all these other things at play.
When you say she had some trauma, there's some pretty serious family trauma there.
Her mom tried to kill her sister. All that she was exposed to as far as movies growing up were porn and horror. Like, that's all they had at their house.
Her mom engaged in bestiality. Mm-hmm. So, I mean, we're talking about some serious stuff that any child who, if exposed to that,
would have some issues.
Would have issues to work through. Yeah, and so Tamara Pietzke, as a therapist who cares about the well-being of her patients, she said, she needs help, she needs more therapy. She needs to have, discuss these things that have happened in her past and her trauma. I'm not just going to sign a letter saying, yeah, go get her testosterone therapy. But she said the dictate from MultiCare and what she was told is you are just expected to sign off. You're not expected to question a child's gender preference or gender identity. And so that's when she quit and said enough is enough and blew the whistle on it. So that was in February. This week, we obtained exclusively a letter that the CEO of MultiCare, Bill Robertson, sent out to the hospital's board of directors. It was sent on July 17th, and it outlines changes that the hospital is going to be making to the gender care that they provide youth. Now, I think it's pretty obvious that the changes spelled out in this letter are a result of Tamara Pietzke, of some of the things that she talked about in her Free Press reporting, of some of the things that she blew the whistle about. We've reached out to MultiCare for them to explain the genesis of this letter and why they've decided to change course. But I think it is pretty clear, and I'll read a portion of this letter, that they have now been convinced to take a more thoughtful approach to the gender care that kids receive. They said they spent the last year doing an extensive review of the best available information on gender care for kids. It says, as a result of our review and based on the best clinical evidence available today, we will enhance our holistic approach to gender affirming healthcare for adolescents. Backed by the most up-to-date science, we believe this enhanced approach will provide the best and safest course of treatment for our young patients. Our new integrated multidisciplinary team we've created to support adolescents seeking gender healthcare includes experts in behavioral health, endocrinology, adolescent medicine, and social work. This team will take a judicious approach to providing care and will work collaboratively with families to support their needs. As part of our efforts to adhere to the best practice approaches we've identified as being necessary, we now require all patients referred from outside providers to be evaluated by the Mary Bridge Children's multidisciplinary team prior to being accepted for care. Mary Bridge Children's does not provide gender-affirming surgeries. So this letter is cautious, but I think the point of it is clear, is that whether they felt pressure to do this or whether they truly reevaluated the best available science, Multicare has decided and is telling its board of directors that they are going to take a more holistic approach when youth come to them seeking gender care, and that it will no longer be simply an expectation that therapists sign a letter saying just send them to the gender clinic, and that is the first course of treatment. And to me, and we're going to bring on Tamara Pietzke here in a moment to discuss this because she is reacting now to this letter that we showed her for the first time. You know, I think the letter reads very diplomatically, right? But I think you also have to consider the state that we're in. In Washington state, it is one of the most progressive states in the nation. We have lawmakers who routinely are trying to push through legislation to strengthen the ability of kids, as young as 12 and 13, to be able to get gender care, sometimes without the consent of their parents. So in this political environment in the state of Washington, Multicare doing this is going to be met with, I think, a fair share of criticism from the left. And certainly they know that when they're taking these steps. So I have to believe that they are convinced these are the right steps to take. I think it's tremendously consequential. Of course, I wanted to ask Tamara Pietzke what she thinks. I got in touch with her yesterday. I shared the letter with her. She was nice enough to join us today to offer her reactions. Tamara, welcome back to Undivided.
Thank you so much for having me again.
Yeah, so you have the letter that we have. Your
Yes.
initial reaction on seeing that they are making some changes.
I'm very grateful to know that that my voice is counted in some small capacity, that they are reportedly looking into the different research that's being put out there, and that they're wanting to do what's best for their clients. I think that that's incredibly encouraging.
Yeah. So you, I think, reading this with your lens of having been there and knowing how things work, explain to us kind of what the big changes are that you see, because they talk about this more holistic approach, which seems to speak to a chief concern that you brought up in your whistleblower report, which is like you were just told, like, sign off and send them to the gender clinic, and they're saying, we want to first kind of surround them with these other professionals. So can you talk about reading that, whether you see that as a change that was brought about by some of your concerns?
I don't know. I hope so. I hope that my voice counted for something. I'm a little bit confused in the letter just because it's not super clear. So I feel like, okay, but we've had those people in place before. So how are they going to be taking on a different role, where we're not just fast tracking people? But I'm glad that it sounds like they're genuinely wanting to look at it from all the different angles.
But what do you make of them saying that they've been doing this review of their youth gender care for a year, since last fall?
It's hard for me to understand how that could be true, since they had the mandatory gender affirming care training in the fall, where I was met with so much hostility for raising any questions or concerns. But if that's true, if they have been looking into it since then it didn't trickle down to any of the supervisors or anyone else in mental health.
Yeah, it would kind of seem weird that up top they're like, let's reevaluate this. But at your level, they're like, you'll just do it. Like there
Yeah.
wasn't sort of this communication. Like you knew something might be off, but you still were, forcing people like Tamara to do this.
Yeah, exactly. Like they were like, well, I want to make it very clear that this is Multicare's best practice. We won't tolerate anything less. And so it's hard for me to understand, like, okay, so you guys are doing that research.
But I look at the letter in its totality and through the political environment that we're in here. Like, this is one of the most progressive places in the country. We have lawmakers routinely pushing through protections for this kind of care, pushing away parents from being involved in this kind of care. It seems like this would be a difficult letter, politically speaking, for multi-care to even write.
Absolutely. I have so much respect for the fact that they're willing to even like to make any changes at all, because I think I know I as an individual was met with the hostility I was met with. I can only imagine the level of like concern that they have as to how this is going to be received by people.
Yeah. So I get, some of the concerns about, this is a little like tepid, right? But, and then at the same time, the political reporter in me is like, but is it? Because I feel like there's going to be some backlash for them from certain segments of the community that they would entertain the idea of reforming the gender clinic. If they're serious about it and they're serious about taking these steps and making sure that they're not just signing off and sending kids to get life-altering care, what do you think the implications of that could be more broadly?
I'm hoping that we're starting to make the world, or at least our area of the world, a little safer for kids. I think kids are so confused and so lost, and it's our job as adults to guide them, and it's unfair, I think, to create an environment where medical professionals aren't allowed to use to exercise critical thinking, and where they're telling parents like, hey, if we don't do this thing, your kid's going to die. Like, that's just not what the evidence is showing. And so we need to be able to create an environment where, like multi-care's letter said, that it's more holistic, where we're like, yeah, this is absolutely causing your kid suffering, but let's not just, start them on hormone therapy. So I'm really hopeful that we're going to start making the world a little safer for them.
If that is the direction that they are truly going, does that make everything you lost worth it for you?
It would be worth it regardless. Absolutely. It makes me feel like a huge, immense, like just relief. But yes, it's worth it because I stood up for my values and I did what I felt like was necessary. And, I think that it's worth it because I was true to myself and I gave a voice to these kids and these parents. But yes, it's like very emotional to see the letter and to be like, oh my gosh, maybe it mattered. Maybe it counted for something,
Yeah, well, it did matter. And I've told you that behind the scenes too. The second you decided to say something, it mattered. And I think it started an important conversation. Would you go back to work there?
Oh,
No, even if they welcomed you back, because it's kind of like,
yeah.
man, if they're all now all of a sudden like Tamara was right, what if they want you to come back and work?
I don't think they're going to go that far as to bring me into it again and apologize.
Yeah. Well, last time we spoke, you were maybe, venturing on your own to do a private practice. How has that been going?
It's going well. It's really been a positive change in my life, getting to do good work in the way that I see it, and just meet people where they're at and make sure that I'm creating an environment where like people feel heard and seen and safe. And when I see kids struggling with their gender, to know that like, okay, I'm not going to try to talk them out of anything, but I know that like they have time to figure this out. There's not anyone pushing me to medicalize them,
Yeah. How are you finding patients, clients?
People see me on different podcasts or reach out to me through like Psychology Today. I have a website, so yeah, people have been reaching out through a variety of different ways.
And you're seeing youth and adults?
Yep. Yeah.
Well, give us your website, Tamara.
It's Pietzke. I don't know if my name's going to be
We'll
somewhere.
put it
It's
up.
a tricky one.
We'll put it up.
Okay. PietzkeCounseling.com.
Gotcha. Well, I think that's awesome. And I think for anyone who actually wants some like genuinely someone who cares and wants to get to the bottom of what's going on, whether it's for themselves or their kids, that's great. I'm just so like proud to know you and proud to have sort of followed you on this crazy situation. And hopefully this is the beginning of something really, really meaningful in terms of the change of gender care. Because if it can happen in, Washington State, where people take a second look, then I think it can happen anywhere.
I would agree with that. Absolutely.
All right, Tamara. Well, I think we'll talk again, okay?
Okay. Thank you so much.
Again, that's Tamara Pietzke, the multi-care whistleblower, and I think now we're seeing the fruits of what she did at tremendous, I think, personal risk. This is not the end by any means. When I read this letter and think about, all the care being pushed on youth, I think there's a lot more that can be done. We have reached out to Multicare this morning with a long list of questions, trying to get clarity on some of the things in the letter. We also want to know, does this apply across the Multicare system? Is this specific to the gender clinic at Mary Bridge? And to ask some of the questions Tamara had about it when she looked at it. If they were, for instance, reevaluating based on new medical information for the last year, whether they were providing the right kind of gender care for kids, doesn't that suggest that they were sort of hesitant to begin with or had questions to begin with? So, did they embark on these efforts to provide this gender care for countless patients and then pull back, as opposed to vice versa, and say, hey, let's study this first, make sure that we really know that what we're doing is what we should be doing, and then we'll do a gender clinic, So it seems like there's a little bit of a cart before the horse situation. But I think significant news to have something like this coming out of Washington State, just outside of Seattle, a very, very progressive area in a state where politicians are constantly pushing to increase access for gender care for youth. And now one major hospital is saying, not so fast. The significance of that cannot be understated. So this is not the last that we're going to talk about this, and we'll update the story when and if we hear back from Multicare with answers to our questions.